Fall Prevention Deserves Your Attention by Michelle Shiflett, OTAS. Are falls avoidable? Absolutely. Today's discussion will include identifying risk factors for falling, strategies and steps to reduce your fall risk, how to get up properly if you do fall, and explore resources that you can use to reduce your risk for falls. What defines a fall? A fall is defined as an event which results in a person coming to rest inadvertently on the ground or floor or other lower level, as demonstrated in the picture on the right, where the gentleman has inadvertently fallen down the stairs. Were you aware? 1 in 4 Americans aged 65 plus falls each year. Every 11 seconds, an older adult is treated in the emergency room for a fall. And every 19 minutes, an older adult dies from a fall. 25% of seniors who suffer hip fractures die within 1 year. Fear of falling. Have you experienced it? Fear of falling is defined as a lasting concern about falling that can lead an individual to avoid activities that he or she remains capable of performing. Falling, or the fear of falling, leads to loss of confidence, isolation, and immobility. What are fall risk factors? Most falls result from interacting risk factors to include physical risk factors, changes in your body that increase your risk for a fall. Behavior risk factors, things we do or don't do that increase our fall risk. And environmental risk factors, hazards in our home or community. Steps and strategies to reduce your fall risk. What can I change? One thing we can change is physical inactivity. Exercise to improve your balance and strength. Sign up for an exercise class. Medications. You should speak to your doctor or pharmacist about potential side effects of your medication. Medication changes can increase your fall risk. Possible medication side effects can include dizziness or poor balance due to the use of antihypertensive drugs or hypnotics. Medications are among the most common causes of increased fall risk in older people. Home safety in your surroundings. It's important. Identify and remove fall hazards in your home to include clutter. Keep things clean and tidy and you won't have to worry about tripping over it. Throw rugs or scatter rugs should be removed. If rugs are necessary or the client prefers to have rugs in their home, replace them with non-slip rugs that have grip bottoms. Steps that are too steep or too long. Most staircases have a handrail or banister to one side, but for elderly people who may be unsteady on their feet, handrails on both sides of the stairs provide additional support. Poor lighting. When we keep our homes dimly lit, it increases the likelihood that we may trip over something that we didn't see. Keeping it too bright, however, is also a problem because it may create a glare. A general rule of thumb for lighting is to keep the home lit well, but not overly lit. Unsteady chairs or tables. When chairs or sofas don't have sturdy arms or backrests, they can easily cause you to fall. Make sure that any chair or sofa you sit in has adequate support. More home safety. Extension cords across walkways. Leaving cords out in the middle of a hallway or the middle of the room is very dangerous. You can trip at night over it and fall to the ground. Make sure that cords stay close to the wall and do not run across the middle of the living room or middle of the floor in general. Toilet seat too low. Toilet seats that are too low can be a major hazard for falls. Typically, the legs start to atrophy when they get older and lose their strength. When it's time to get back up from the toilet, sometimes your legs give out and you fall. It's very important to have grab bars along the wall next to the toilet that you can grab. You can grab these bars also to help propel you up. Another good option is to use a booster seat. This is a type of seat that sits on top of your current toilet seat. It's a great safety precaution because you don't need to squat down as low. As you can see in the bottom right picture, this is one example of a booster seat that can be purchased that also has rails on the side to help propel you up. We also want to make sure that you be aware and take extra caution on sloping driveways and cracks in sidewalks. An occupational therapist can perform a home assessment and help identify safety issues and solutions in your home. What else can you do to prevent falls? One of the greatest contributors to falling is blindness or vision impairment. Having yearly annual eye exams after age 50 can help identify vision problems. Wearing multifocal lenses may blur or distort your vision looking down. Removing cataracts also may reduce your fall risk. Eliminate unsafe clothing and footwear. Wear well-fitting slippers with non-slip soles. Avoid clothing that is too loose or that is too long and drags on the floor. Additional measures that can be taken include bringing commonly used items to lower shelves in the kitchen, using a reacher to pick up things from the floor as demonstrated in the picture. Head rushes when you stand too quickly. Does this happen to you? If it does, rise slowly and count to 5. Modifications to the bathroom can include adding grab bars to shower walls, using a bath chair and handheld shower, and using non-slip tub mats. What happens when you do fall? Safety first. If you have fallen and you are not hurt, you can follow these steps. Number 1, if there are no injuries, slowly roll onto your side, starting the movement with your head and moving down towards your feet. Take a moment to rest. Step number 2, slowly push up into a crawling position and crawl slowly on hands and feet toward a sturdy chair or piece of furniture. Don't rush and rest as needed. Place your hands on the seat of the chair one at a time. Number 3, supporting yourself with the chair, bring your strongest leg up to a 90-degree angle by putting the foot flat on the ground. The other leg stays in the kneeling position. Slowly push up to the standing using both arms and legs. Step number 4, slowly turn around and lower yourself onto the chair. Sit and catch your breath for a few minutes before doing anything else. These steps are also demonstrated in the picture on the right and can be located at www.findingbalanceberta.ca. What happens when you do fall? So you are fallen and you are hurt. First, stay calm and rest for a few moments. Figure out what parts of your body are injured. If you have one, use an emergency medical alert device or mobile phone to call 911 or a family member for help. Tell them about your injuries. Number 3, if there's a pillow nearby, put it under your head. If there's a blanket or some clothing nearby, use it to keep yourself warm while you wait for help. And if you don't have a medical alert device or a phone nearby, start yelling for help. If you can't yell, grab something nearby and use it to bang on the floor or on nearby furniture to make noise and attract attention. The 2 pictures on the right demonstrate 2 options for a medical alert device. Evidence-based fall prevention, resources which can be found through the National Council on Aging's website. The first one is called A Matter of Balance, which is an 8-week structured group intervention that emphasizes practical strategies to reduce fear of falling and increase activity levels. This program enables participants to learn to view falls and fear of falling as controllable. They set realistic goals to increase activity and change their environment to reduce fall risk factors, and exercise to increase their strength and balance. All of the exercises can be done in a sitting or supported standing as demonstrated in the picture below. It is excellent for people who are fearful of falling and a great start for the later intervention program Stepping On. The direct website link can be found below. There are more evidence-based programs that can be found through the National Council on Aging's website. Some of these are called Bingo Size, Capable, Enhanced Fitness, Falls Talk, Fallscape, Fit and Strong, Healthy Steps for Older Adults, Healthy Steps in Motion, the Otago Exercise Program, SAIL, Stay Active and Independent for Life, Stepping On, Tai Chi for Arthritis, and many more. Remember, falls are absolutely preventable. Move more, sign up for an exercise class. Review your medications yearly with your doctor or pharmacist. Have yearly vision exams. Look at home safety. Look at things that can cause you to fall, such as loose cords or clutter. And consider having an occupational therapist come to your home to help identify safety issues and solutions. Thank you for coming to my presentation.